Today I'm going to talk to you guys about ergonomics. Next. What is ergonomics? OSHA defines ergonomics as simply the study of work. More specifically, ergonomics is the science of designing the job to fit the worker rather than physically forcing the worker's body to fit the job. Adapting tasks to workstations, tools, and equipment to fit the worker can help reduce physical stress on the worker's body and eliminate any potential serious disabling related musculoskeletal disorders. The high cost of MSDs. 34% of all lost workday injury and illness is from MSDs. 600,000 employers report 600,000 MSDs requiring time away from work every year. 1 out of every $3 for workers' compensation. 15 billion to 20 billion for workers' compensation is what's paid out every year, and it costs overall 50 billion annually. On an average, it takes about 28 days for somebody to recover from an MSD. Next, and these are the basic type of MSDs basically that you can get from not practicing proper workplace ergonomics. Is carpal tunnel syndrome, tinnitus, tennis elbow, and lower back problems. And as you can see, they're mostly in the joints. Next, this is one of the causes from it, is high task repetition. Many work tasks and cycles are repetitive in nature and frequently controlled by hourly or daily production targets and work process. High task repetition, when combined with other risk factors such as high force and awkward postures, can contribute to the formation of MSDs. A job considered highly repetitive if the cycle time is more than 30 seconds or less. And these three things are different things that you could do to prevent it, which is alternate tasks. So if you're doing something and you know you have to be there for a while and it's an awkward position, maybe stop doing that and do something else for a little while that you're not doing on that job. Take several breaks, like micro breaks and stuff like that. Maybe stretch it out a little bit if you're stuck in a really awkward position for a while. Forceful exertion. Many work tasks require high loads on the human body. Muscle effort increases in response to high force requirements, increasing associated fatigue, which can lead to MSDs. So try to relax. Your body gets really tense, especially if you're, like we're wrenching on stuff all the time. If you're in a really bad position, your body gets really tense. You might not feel it, but you will tense up. So just try to relax, stretch it out. Next, sustain awkward postures. Awkward postures place excessive force on joints, overload the muscles and tendons around the affected joints. Joints of the body are the most efficient when operated closest to the mid-range motion of the joint. Risk of MSDs increase when joints are worked outside of the mid-range repetitively or for sustained periods of time without adequate recovery time. So again, change your body position when you're up there, when you're working. Try not to stay in an awkward position for a really long time. Rearrange your work area so it suits you better. So if you have to fit in there, if you have to move stuff around, like say you have to work in a generator, you're not reaching through a bunch of crap, so you're in an awkward position. Take rest breaks, take little micro breaks throughout it. Next, and this is the ergonomic process. So this is just like what you would do to set up like a proper ergonomic workplace. So you prioritize the jobs. So just go through and like basically look at what you're doing. Basically, conduct ergonomic analysis. So just think about what you're going to be doing and how you want your stuff set up so it's ergonomically correct. Develop ergonomic opportunity list. Again, you're kind of just going through and seeing what you could set up, so everything's set up properly ergonomically. Next, determine best solution with team approach. So this one is basically just should a team be involved on whatever you're doing. So if you're lifting something heavy, stuff like that. Obtain final approval and implement solutions. So kind of go over with supervisors and actually put this forth. Evaluate the ergonomic improvement for effectiveness. So did this really work? Should we keep using it in the future? And that's it.